Hey, my name is Ann-Kathrin or AK Eisfeld. I'm currently an assistant professor in the Division of Hematology at The Ohio State University in Columbus, Ohio. I'm also the co-director of the newly founded Clara Bloomfield Institute for Leukemia Outcome Research. I'm very excited to share today the results of our study, and that hopefully help answer the question whether race impacts on the outcomes of patients diagnosed with acute myeloid leukemia. So the question whether race is an influencing factor on the survival of AML patients is not a new one and has been studied since several decades. And it has been shown before in larger socio-demographic studies that Black patients diagnosed with AML have shorter survival. And the main reasons that had been identified previously before our study were socioeconomic factors such as like lower incomes, lower access to care, lower access to clinical trials and to up-to-date treatments, as well as identified factors that it is less likely for Black acute myeloid leukemia patients to receive a stem cell transplant, for example. Our study expanded on these previous studies in several ways. The first one was that we looked into more recent data of over 20,000 AML patients that were treated almost nationwide at the United States. But then even more importantly, we were able to look at, for the first time, at comprehensive biologic factors such as gene mutations, which are one of the most important prognosticators for outcome in AML. And what our study was able to show is that, in fact, the frequencies of gene mutations that we commonly see, what we believe we know in acute myeloid leukemia patients, differ in their frequencies between Black and white AML patients. And more importantly, not only the frequencies differ, but also the associated outcome impact that we are known to use in clinical practice every day, such as those of the European Leukemia Net classification.